Africa. It's a platform of former heads of state, vice president, prime ministers, and ministers. Most of them are Africans, but there are renowned non-Africans on our board. Our board is currently chaired by His Excellency Olusegun Obasanjo, former president of the Republic of Nigeria, who opened this series of dialogues that started yesterday. We had a rich set of messages coming from elders, not only the institutions, but mainly faith leaders and traditional leaders. My brother, Dr. Benjamin Judelbai, will attempt to summarize what we heard yesterday, the messages. He will be followed by, and the rest of the afternoon is going to be moderated by a great son of Africa, Professor Arthur Mutambara, former Deputy Prime Minister of Zimbabwe, Professor of Robotics and Mechatronics, who focuses on the opportunities and challenges of the fourth industrial revolution in Africa. But to us, CoDA, he is someone who has extensively been involved in socioeconomic and political issues, both on the continent and globally. Madam Commissioner, thank you for joining us. Welcome to this session.
Thank you.
Thank you, Madam Commissioner. So that we don't run out of time as we did yesterday, it is my utmost pleasure to give the floor to my brother, Dr. Benjamin Judelbai. Dr. Judelbai heads the Division of Policy, Health Diplomacy and Communications at Africa CDC. He was with us yesterday. He summarized the sessions of yesterday. He will be able to repeat some of these, the key messages that we heard yesterday. Thank you all for joining us for CoDA 2021 First Core Policy Dialogue. Dr. Judelbai, you have the floor.
Merci beaucoup d'être associé à cette série de dialogues. Je tiens avant toute chose à souhaiter la bienvenue à chacune et à chacun d'entre vous. À cette deuxième journée, nous avons eu une première journée qui était extrêmement riche et mon souhait est de voir cette deuxième journée également extrêmement productive. Je vais d'emblée vous dire que la journée d'hier a été extrêmement riche avec les idées qui ont émergé des différents intervenants. Je ne vais pas avoir la prétention de faire un résumé exhaustif de tout ce qui a été dit. Un rapport est en cours de préparation à cet effet-là. Je vais juste souligner les points saillants de ce que nous avons tous été témoins hier. Alors, il y a eu une cérémonie d'ouverture qui avait été modérée par Madame Souad, qui vient de parler, qui est la secrétaire exécutive de CoDA, et 4 allocutions ont marqué cette session. Celle de Dr. Ahmed Ogwel, qui est le directeur adjoint d'Africa CDC, celle de son Excellence Dr. Monique Sanzabagawana, qui est la vice-présidente de la Commission de l'Union africaine, l'allocution du professeur Bénédicte Orama, qui est le président de Afreximbank, et l'allocution d'ouverture de son Excellence Olusegun Obasanjo, ancien président de la République fédérale du Nigeria. Tous ces intervenants ont mentionné les effets néfastes de la pandémie de COVID-19, non seulement sur les vies et sur les économies à travers l'Afrique et à l'échelle mondiale. Ils ont également mentionné la nécessité d'impliquer tous les secteurs de la société pour maintenir, pour maîtriser cette pandémie. La nécessité de parvenir à une immunité collective sur le continent en vaccinant les populations a également été soulignée par les différents intervenants. et le besoin de trouver une stratégie vers l'avenir de l'Afrique à faire face à toutes les futures pandémies en appuyant la recherche et le développement des vaccins et également le renforcement des systèmes de santé qui doit rester une priorité capitale pour nous. Nous avons ensuite eu droit à une première session qui a été marquée par les messages de bonne volonté des leaders communautaires et religieux. Et nous avons été ravis d'avoir le message de son Excellence chef Epidemiological qui a salué les efforts d'Africa CDC. Il a également déploré le manque de capacité pour la fabrication des vaccins sur le continent africain et a souligné la nécessité d'investir dans le développement des vaccins sur le continent. L'évêque Chian a encouragé tout le monde à se faire vacciner en soulignant que le vaccin n'était pas dangereux pour l'homme. Et il a également dit que le pape a pris le vaccin et a encouragé les autres à faire de même. Il a aussi dit que prendre le vaccin était une option éthique importante pour protéger les vies. Cheikh Abdul Karim a déclaré que le grand imam de la grande mosquée de la Mecque avait également pris le vaccin et qu'il encourage les autres à le faire. Il a également noté l'importance pour les pays africains, le besoin d'avoir des politiques et des protocoles coordonnés sur les vaccins contre la COVID-19, et non seulement sur les questions de vaccins, mais sur les questions de santé en général. Ensuite, nous avons eu droit à une deuxième session qui traitait de la question de la réponse africaine à la COVID-19 et Dr Ahmed Ogwel, le directeur adjoint d'Africa CDC, a fait la présentation et il a présenté la situation épidémiologique sur le continent et également il a donné une vue d'ensemble de la riposte de Africa CDC et de la Commission de l'Union africaine depuis le début de cette pandémie. Et cela inclut les initiatives clés qui ont été mises en œuvre, et j'en citerai quelques-unes. Le partenariat pour l'accélération des tests en Afrique, qui a permis de déployer plus de 20 millions de tests sur le continent avant même le délai qui avait été donné. Et il a également mentionné comme exemple la mise en place du fonds COVID de l'Union africaine. Et il a souligné la nécessité d'investir dans des systèmes de santé résilients sur le continent. Et l'Afrique doit continuer par vacciner et monitorer de manière très de manière, je dirais, de très près les effets, les potentiels effets secondaires des vaccins. Nous avons eu également droit à la réponse de Mme Atsuko Toda qui avait souligné que pour que l'Afrique arrive à l'immunité de groupe, il fallait justement vacciner 60% de la population du continent pour pouvoir contenir cette pandémie. Et pour cela, il faudrait justement étendre la couverture vaccinale au-delà de 20%, et les 20% qui sont actuellement en cours de mise en œuvre, notamment grâce à l'appui du programme COVAX. Il a également fait mention de l'hésitance, comment je dis, de l'hésitation et de la résistance face au vaccin qui constitue un frein au déploiement des vaccins et qu'il serait important que des messages clairs soit transmis à travers les médias pour augmenter en fait l'adhésion du public à la prise du vaccin. Ensuite, nous avons eu Dr Abdenassir de l'OMS qui a salué les efforts d'Africa CDC et de l'Union africaine en général dans l'effort fourni pour la réponse à la COVID-19 et surtout le renforcement de la collaboration transfrontalière. Il a dit que nous devons également renforcer l'expertise technique pour que les questions de pandémie, la gestion des pandémies sur le continent soit la gestion des pandémies soit adéquate sur le continent. Ensuite, nous avons eu une troisième session qui parlait de l'accès, de la stratégie d'accès au vaccin, et cela également qui a présenté la stratégie pour le développement des vaccins et surtout l'accès aux vaccins sur le continent. Et pour cela, il a dit qu'il y a 14 sites actuellement dans 8 pays qui sont en cours, qui sont en train de mener des essais cliniques en ce moment, et qu'il y a bientôt, il y aura d'autres qui vont s'ajouter à cela. Il a également donné la stratégie, surtout mentionné l'aspect financier plutôt, avec Afreximbank et COVAX, qui sont en train d'appuyer actuellement. Et il avait également dit que l'Afrique était en train de traîner les pas en ce qui concerne l'accès actuellement au vaccin. Cela constitue un défi terrible, surtout il y a un défi sur le plan logistique et il y a un défi qui est lié à la nature du virus même avec les différentes mutations. Ensuite, nous avons eu droit à la présentation de Tabani Maposa qui avait présenté un bref aperçu sur les actions mises en œuvre par COVAX et la quantité de vaccins qui étaient disponibles au niveau en fait des pays africains, et que tout le monde devait être fier de ce que Africa CDC est en train de faire en ce moment, de manière que Africa CDC n'avait pas en fait gaspillé cette pandémie, mais plutôt c'était une opportunité qui avait été bien saisie par Africa CDC. Donc, voilà pour la troisième session. Nous avons eu également des réponses de la part d'Evelyn Kibushi et de Seydon Sayed, qui ont dit que les Africains ont besoin de croire en leurs institutions et que chacun devait être engagé dans la production et la distribution des vaccins en Afrique. Donc voilà très rapidement, de manière ramassée, ce que j'avais à dire pour rafraîchir les mémoires de ce qui s'était passé hier. Je vous remercie et je vous redonne la parole, Soit. Merci.
Merci infiniment, Dr. Judelbaï. C'était un résumé assez juste de ce qu'on a entendu sur 3 heures. Merci d'avoir pris le temps de bien faire ressortir les messages clés de la session, des 3 sessions d'hier. J'aimerais passer la parole au modérateur qui va modérer les 3 prochaines sessions. Professeur Arthur, à vous maintenant.
Thank you very much, Saudi. Welcome, everyone. Our protocol has been adequately observed. Ladies and gentlemen, today our concentration is on understanding the Africa COVID response. We want to make sure the different stakeholders on the continent have clarity on what our response is. Why is this important? It is important because we want complete buy-in and ownership of the COVID-19. Our young people, our experts must be on board. So the motivation today is to improve and increase our understanding of that response and get views from the various stakeholders, in particular, our young people. Also, we want to think about what can we do to empower Africans beyond COVID? What can we do to empower young people beyond COVID? And we want clarity on actionable policies that will bring about the empowerment of Africans, the empowerment of young people beyond COVID. Young people are very important. You know, young people, you've heard young people are leaders of the future. No, young people are leaders of today. History has been made by young people. So it's important that as we structure our COVID-19 response, our young people are on board. Our first session is about views from various stakeholders. We're going to have 3 speakers who are going to have 5 minutes each. They're coming from the AU, they're coming from ECOSOC, and they're coming from our young people. Our first speaker is the Commissioner, Sarambi Young. She's the Commissioner for Education, Science, Technology, and Innovation. And also, she's representing the Commissioner for Economic Development, Trade, Industry, and Mining. So the Professor Young is here representing the AU, in particular, education, science, technology, and innovation. More importantly, she's also representing the Commissioner for Economic Development, Trade, Industry, and Mining. She was elected Commissioner of Human Resource, Science, and Technology of the African Union in 2017. In her role as Commissioner, she oversees and leads the development of regional and continental agendas aimed at improving education, youth, capacity development, as well as science and technology. These are the constituencies. These are the stakeholders. We want to have all these stakeholders on board in terms of our response. Before being elected, she was Deputy Vice Chancellor in charge of research, Cameroon cooperation relations, and with the business world at the University of Benue North in Cameroon. She has also served as Inspector of Academic Affairs at the Ministry of Higher Education. She has authored over 13 peer-reviewed book chapters, 3 textbooks, and many scientific publications. We are in good hands in terms of technology. We're in good hands in terms of innovation. We're in good hands in terms of views from the African Union. Professor Young, the moment is yours. You have 5 minutes.
Thank you very much, Prof. Come on, picture of the phone. Thank you very much, Prof. I'm multitasking at the same time in 2 different meetings. I want to stand on the existing protocol, Prof. And I want to thank Dr. Benjamin for his summary of what took place yesterday. Excellencies, distinguished guests, ladies and gentlemen, I want to personally and on behalf of the chairperson of the African Union Commission, His Excellency Dr. Musa Faki Mahamat, express appreciation to CoDA-Africa CDC, Afreximbank, AFDB, and ECOSOC for organizing this important virtual dialogue entitled Africa's Response to COVID-19 and Equitable Access to Vaccines and Vaccination. As the world moves towards global vaccination, it is important that we have the discussion on how young Africans can be empowered in the post-COVID Africa. Ensuring young people are empowered, have opportunities for their advancement towards the attainment of their full potential requires increased investment in youth. And you, Professor Arthur, have been able to speak on the importance of youth for the sustainable development of Africa. This is critical because in the context of a rapidly evolving post-COVID world, it is even more important that young people are at the center of the development. As a result, the Youth Division developed the COVID Youth Response 3x4 model, which focuses on reducing the health risk on young Africans. And this 3x4 model includes be a responder, be an innovator, be safe, and continue learning. And this will be to minimize the impact of COVID-19 on their lives and mobilizing youth to be responders to COVID-19 through engagement, communication campaigns, innovation, and partnerships. This speaks to the fact that it is becoming increasingly obvious that our approach to youth empowerment must be dynamic because and fully acknowledge the contributions and potentials of young people. As various economies in Africa recover from the economic impact of the COVID-19 pandemic, youth empowerment has the potential to exponentially transform Africa's economy. From this standpoint, it is imperative to address the challenges that hamper youth innovation, development, and empowerment. These myriads of challenges include everything from protecting intellectual property to easing the business environment. Many African countries continue to make gains. There are still opportunities for accelerating easing these challenges. Significant investment in nurturing the youth initiatives and providing financial and non-financial support to encourage young people, capacity building for entrepreneurs, etc. Excellencies, distinguished girls, ladies and gentlemen, recognizing that much is happening to support young people, we need to ensure that we put our efforts and investments in the right places. We need to address the systemic bottlenecks that hamper growth and integration across Africa. While this can be seen across various sectors and segments, I will make the example of youth entrepreneurship, as it is a sector many of us are interested in. While we expect young people to do well, to take advantage of the after by launching and running businesses across Africa, the very foundation of success as a young entrepreneur is making sure the environment allows you to do business. In other words, you can focus on your business and drive for productivity rather than spend all your time and resources on auxiliaries to running your business. To support the youth in building back better post-COVID, we must reassess the lessons learned and develop youth-focused continental solutions. Youth engagement and mobilization initiatives should be geared towards ensuring that young people are able to bounce back from the current COVID situation with minimal impact to their lives. And therefore, the vaccination process in the various countries must include a youth portfolio. Young people must be given the space they need to be industrious and to forge innovative solutions to create the post-COVID-19 future they want for themselves, their peers, and their community. That is why the African Union Chairperson, the 1 Million by 2021 initiative, to completely reach millions of young Africans from across the continent with with opportunities and interventions in the 4 key areas of entrepreneurship, empowerment, education, and engagement. Through investing in new skills, through transfer of technology, we increase employment prospects for our youth. Therefore, the inclusion of young people in trade remains critical. I want to express my sincere appreciation to the organizers. Your partnership towards strengthening youth empowerment in the post-COVID Africa is timely and crucial in achieving the Africa we want. I thank you.
Thank you very much, Commissioner. You were right on time. There you get it. Young people are leaders of today. Young people are history makers. Let us involve them in our strategy around COVID. Thank you, Commissioner, for emphasizing partnerships. Thank you, Commissioner, for emphasizing young people's empowerment, entrepreneurship, and also the case for transformation on the continent. Thank you very much, Commissioner, for emphasizing issues around the environment. As I move to our next, speaker.
So, please don't forget I'm sitting in for Commissioner Muchanga.
Yes, I've indicated that already. Yes, she's also representing the Commissioner for Economic Development, Trade, Industry, and Mining. So she's hearing 2 heads, her own head and somebody else's head. Thank you very much, Commissioner. Now, as I move on to the next speaker, why do we care about all stakeholders?
Professor, if I may, Professor, this is Swad. I'm sorry to interrupt. There is the official announcement of the death of the President of the Republic of Chad. I would like us to take a few minutes to say something. J'aimerais au nom du conseil de CoDA présenter nos sincères condoléances au peuple tchadien et à la famille du former président Idriss Déby Itno, qui est mort au front. L'annonce a été faite il y a quelques heures. Nous sommes réunis ici pour discuter des effets de la pandémie qui a emporté plusieurs Africains. C'était un Africain, un président d'une grande république. Nous sommes attristés comme le sont les membres de sa famille et de ses amis. Nous aimerions donc présenter nos sincères condoléances. Merci, professeur, pour ces minutes. À vous.
Thank you very much for those words.
Prof, I think he did not die of the pandemic. It must, because the way she said it, they will think he died of the pandemic. He didn't die of the pandemic.
That's correct, madam.
Okay. Thank you very much for that intervention. We're moving on to our next speaker, and I want to emphasize the importance of stakeholder involvement, the importance of reaching out to all our various stakeholders. Why are we doing this? We want what we call an ecosystem approach. For our COVID response to be successful, it must be driven by an ecosystem approach. The women, the young people, the experts, the leaders, the traditional leaders, and so on and so forth. Now we're moving on to ECOSAC, and we're going to get some views from William. William is the head of the Secretariat of the Economic, Social, and Cultural Council. He's a PhD candidate at the University of Stellenbosch in Cape Town. He also has a degree in strategic marketing from the University of Derby in the UK. He has more than 20 years of international development experience, international and local governments in Sierra Leone and Kenya. He is widely experienced in terms of civic society and in terms of the activities of ECOSAC. He has served on other senior management positions and coordinated and supported different projects and programs at both national and international levels while at the ADB in Abidjan. He is here representing ECOSAC. He is also coming from academia. So we have ECOSAC as a constituency. We have academia as a stakeholder. So William, tell us your views. Let us work together and have a clear and broader understanding of the COVID-19 response of the continent. William, the floor is yours. You have 5 minutes and 5 minutes only. Thank you.
Thank you very much, moderator. Let me also take the opportunity to join my sister SWAD on behalf of the citizens of Africa, and that is represented through ECOSOC, to extend our heartfelt condolences to the people and governments of the Republic of Chad. Excellencies, colleagues and friends, I am sure if we could rewind time for just a minute and feel what life was like before COVID-19, a lot of us will take that option. The last year or so has seen a lot of changes to our daily lives and even more challenges. Not being able to see family, loved ones, restricted travel, quarantine measures, the list can go on. However, I am glad we can all be meeting for this two-day event, as it shows our resilience and willingness to find a solution and move past this pandemic. Not too long ago, we were attending the Africa CDC webinar to learn about the novelties of the coronavirus, distancing measures, and how PPEs will be distributed among all AU member states. Now we are attending a two-day CDC series talking about the novelties of the coronavirus vaccine, how the CDC plan to roll them out, the implementation of the COVAX facility, and how to empower young people in post-COVID Africa. In that regard, I would like to express my sincerest gratitude to the African CDC, not only for taking initiative during the response and now recovery stage, but for also opening up spaces like today's where we can talk and ask the right question. Today, we get to talk and ask questions surrounding the vaccines, and most importantly, about youth empowerment in a post-COVID-19 Africa. Today, equally, we're eager to get a post-COVID Africa and some form of normality, we have to accept that this is only possible through living comfortably and opening with the vaccine. Up until recently, the various vaccines have been greeted with skepticism and surrounded by false information. Now, while people seem more open to the idea of vaccines, varying news sources have talked about some vaccines causing blood clots, other vaccines being more effective than others. So it is easy to see why people are on the fence about vaccine. However, despite all this worrying rhetoric, the science is proving to be more effective than harmful. And while you do not have to take my word for it, I am more than excited to listen to the expert here today that will speak on vaccine and how CDC plan to distribute them among all AU member states. Ladies and gentlemen, today's topic is on vaccination and youth empowerment in a post-COVID-19 Africa. We have the experts in our midst who will surely elaborate on the vaccination, but I want to seize today's opportunity to talk about the African youth in the fight against the pandemic. The numerical losses throughout the last year to the pandemic have been devastating. Although our numbers have not reached the height of others, any loss is still significant. Another significant loss has been the impact of the COVID-19 pandemic on our youth. Coronavirus and distancing measures forced schools to shut down and go online. This has exposed the frailties of our education system that has left a good number of our youth behind in their studies. Aside from that, loss of jobs or even lack of has altered the intellectual growth of our young people and the economic growth of our countries. While we can all agree that coronavirus has been tough on us, it has also served as a teacher in many aspects. Our health systems can be better, our education system can be updated to fit the needs of our children, and the job market can be galvanized enough so that the youngest continent in the world does not suffer the same rate of unemployment and struggle as it did pre-COVID. In that regard, I'm also delighted to be part of this conversation that will also focus on youth empowerment in post-COVID-19 era. What is equally encouraging is that young people have already taken initiative to be entrepreneurs and innovators in the world where the job market has suffered greatly. With the right support, these young entrepreneurs can innovate ways to facilitate life past COVID and remedy the rate of the continent's unemployment. The International Development Research Center published an article back in August on boosting youth employment in Africa during and after the pandemic. Something stood out was the sentence reading, traditional jobs are being transformed and a new form of work are being created, speeding up the digital revolution on the African continent. New opportunities are also arising as global supply chains reconfigure. There is a saying, in adversity lies opportunity. As much as we need to muster our effort to be COVID negative, we need to strive forward by being mindset positive. At ECOSOC, we have adopted a new mantra, to build forward better together. And this is the right mindset that we need to share across the continent. Sadly, we have been traditionally undermining our own potential, but it is now or never the time to rise up, to empower, to challenge, to inspire, and to take our destiny in our hands. It is refreshing to note that during the pandemic, we have seen glimpses of a new African emerging, where its citizens are teaming up to fight the pandemic with whatever little resources is available. Why should we continue considering ourselves as dependent? I am openly challenging our youth today. Can't we change this narrative? I believe in you all. Africa believes in you. During the pandemic, some young innovations have taken up the fight against the pandemic and are now producing ventilators, masks, and technological solutions to curb its spread. We have all witnessed African youth develop contact tracing, mobile application, all power both portable hands-free sanitizer machines, just to name a few. I want to lay emphasis on our youth. I feel that this is one of the platforms we must share some of the achievement. Two Ghanaians from the Ashanti region, namely Richard and Jude Osei, developed a prototype of a solar-powered hand washing machine, timed with a sensor. Senegalese
William, can you wind up, William? You're not running out of time, William. Wind up, William. Wind up.
ECOSOC is working on a special recognition for Africans for their innovative ideas. We also need to recall that 2020, ECOSOC has pioneered a webinar series in partnership with African Development Bank, and on the 25th June, we hosted a special webinar looking at the role of youth in shaping post-pandemic Africa. I want to take this opportunity to conclude by thanking all of you and to challenge the young people of Africa that this is our time. There is no more the issue of youth being the leaders of tomorrow. They are the leaders of today. They can make and be the real change maker for the new Africa we want. I thank you.
Thank you very much for that strong advocacy for our young people. Our young people are leaders of today. Thank you very much for those words of wisdom around youth empowerment. Yes, we must build back better. Yes, we must say a crisis is too important an opportunity to lose. We must not miss it. Yes, COVID has been devastating, but what can we learn from COVID? How can we use COVID as an opportunity? Thank you for those words of wisdom. Now we're moving to a young man, Philemon. Now, Philemon, here's your message. Each generation must, out of relative obscurity, discover its mission, fulfill it, or betray it. Philemon, this is a message to you from Frantz Fanon. What is the mission of your generation? Why don't you make creating a new public health order in Africa your mission? Your generation must have a mission. What is your mission? Once you identify your mission, you either betray it or you fulfill it. So as a young person, Philemon is the president of Famusa. Now, what is Famusa? This is the Federation of African Medical Students Association. He's the fourth-year medical student at the University of Abuja. So Philemon is here representing young people. Tell us, Philemon, what you are passionate about. You're passionate about representing Africans in global health and also empowering Africans in healthcare. You're also involved in leadership among the Africans. FAMSA is an independent, non-political organization founded in 1968 as a Nigerian, Ghanaian, and Ugandan initiative to foster the spirit of friendship, cooperation among African medical students. FAMSA is a project-oriented medical students body and is recognized by WHO and the AU as the official international forum of African medical students. These are these constituents we're talking about. These are the stakeholders, the young people, the doctors, the young doctors, the doctors in training. In 2020, FAMSA formed a technical working group to support the response to COVID-19 pandemic. And this group has been working in partnership with the African Union to achieve a coordinated continent-wide response. So it is important that our young people are on board. it is important that our young medical students are on board. And so, Peter Philmon, the moment is yours to share with this august gathering about the views from young people, the views from young doctors, the views of the leaders of today. Young people should be masters of their own destiny. Young people must identify their mission. What is your mission, Philmon, and your generation?
Thank you very much, Sir Otto. I'm Philemon, and I'm very grateful for this opportunity to speak here to CoDA, and I want to appreciate CoDA, the African CDC, and the African Union for this opportunity. So quickly, I would want to say that the COVID-19 pandemic is a subtle reminder of how fast Africa needs to continue in building structures, institutions, and policies towards improving healthcare in Africa. And one key mission of FAMSA member states is towards the development and improvement of healthcare in Africa. And we believe the only way of doing this is going back down to the grassroots to see that we bring up the coalition of different African medical perspectives from different backgrounds, from different cultures, and all of us coming together to bring up one new strategy. So throughout the COVID-19, we've been working so hard. We've been putting our backs into it because the COVID-19 had already left us at home, not going to school and all that. So we've been very, very challenged with the African situation, and that has led us to bring up some major information that we want to share that we think Africans should look into, and the African Union and CDC should look into. So we are calling, we are ready to collaborate, we are ready to support and work with all African member states to show solidarity and actively contribute towards the improvement of towards the implementation of the African Union Development and Access Strategy and the works of the CDC. We are here to strongly say that we're kicking against vaccine nationalism, and that is one thing we want the whole African continent to look into. Even now that we're fighting towards to see that we want that there should be development and there should be improvement, and to see that the youth that the African Union and the African CDC and even CoDA actively support youth organizations to build capacity and infrastructure for the future development of Africa and healthcare and otherwise. Now, the truth is, even if we want to develop healthcare in Africa, going beyond that, it's very capital expensive to build healthcare in Africa. And we realize that, and that is why we are not really zoning or focusing mainly on just improving the healthcare in Africa. We're zoning and focusing on economics, because it is in economics, and when Africans make more money and there is more capital and more finance to African member states, that is when they can fund healthcare in their situations. Now, we're also calling that they actively ensure that youths are part of these processes. We want youths to be sitting on all these tables where you are making these policies, where you are making these decisions. Youth should be actively there, especially the young doctors. When it comes to pandemics, like throughout this pandemic, many of us in the African medical students, we had to sit at home. There was no opportunity for us to actively go on the field and support or show our solidarity towards fighting the coronavirus. But we did our best by staying at home, fighting through visual spaces, holding webinars, and also bringing up innovation. So our major call and our direction is towards improving healthcare in Africa, and we can only do this when we get the active support of major organizations in the African continent who are seeking to build our capacity, not just going to schools and becoming graduates, but also building our capacity to become producers, to become a continent like what His Excellency Baba, that is former President Olusegun Obasanjo, spoke about yesterday, developing the vaccines and ensuring that they are being transported and everything is going on here in our African continent. That is what we want as the youth. We don't want the whole dependency. We want the African continent and African healthcare to be independent. We want to produce our drugs, produce our vaccines, and build our own hospital equipment right here in Africa. That is what we seek towards the improvement of healthcare in Africa. Thank you very much, and that will be all from the Federation of African Medical Students. Once again, we want to appreciate CoDA, we want to appreciate African CDC, we want to appreciate the African Union for this wonderful initiative. Thank you.
Okay, thank you very much, Philmon. After listening to you, I can only say the future of the new public health order in Africa is in safe hands. You were very clear that young people are opposed to vaccine nationalism. You are very clear that young people would want Africans to produce their own vaccines. You want Africans to have agency in terms of the production of their own medicines, in terms of owning the entire value chain. That is what we want as Africans. And I'm glad our young people are on board. The young doctors are on board. The young entrepreneurs are on board. Africa's future is in good hands. We want to build a new public health order in Africa, and young people are going to be in charge of this agenda. So thank you so, Philemon, for being with the program. Now, before we move on to the next section, let me summarize what we have done so far. What we've done so far is to involve various stakeholders. We've heard from the AU, we've read from innovation, from technology, from education. We've read from ECOSAC, we've heard from students, we've heard from young doctors. These are the people of Africa who must own and drive the COVID-19 response. These are the stakeholders who must have buy-in and ownership of that strategy. We want an ecosystem approach to COVID in Africa. You can't have an ecosystem approach if you leave other constituencies out. So I'm very happy today we're able to get 3 statements from 3 key constituencies representing various stakeholders in terms of COVID-19. Before we move on to the next session, we're going to give an opportunity to Professor Bazuye, Chief Medical Doctor at the University of at Ibadan University Teaching Hospital, Chair of the Independent Task Team established by CoDA. He's going to share with us a few words. Professor, you have 4 minutes to share with us. Professor Bazuye.
Thank you very much. Thank you for giving me 4 minutes. I'll try as much as possible to talk within the 4 minutes. I must say that I want to thank CoDA, African Union, and African CDC for organizing this program. I listened keenly yesterday. Talks from elders, especially Professor Olusegun His Excellency Olusegun Obasanjo, and also the Chancellor of Igbinedion University Teaching Hospital, Chief Gabriel Osawa Igbinedion, the founder of Igbinedion University Teaching Hospital and Igbinedion University, Okada, and also so many speakers. I think from what has been said, there is need for us to actually go beyond the talking and begin to think about how we can actually get some of these things done in Africa. I want to say that I was privileged to be able to champion stem cell transplantation in Africa. And in 2009, it was postulated that stem cell transplantation cannot be done in Africa, I mean in the developing countries. And from 2011, with Igbinedion University Teaching Hospital, we've been performing stem cell transplant for both sickle cell and malignant conditions. And that's a challenge to the youths and other areas of science, that we could actually be able to domesticate the production of vaccines in Africa. And also to collaborate what His Excellency Olusegun Obasanjo said yesterday, that the Igbinedion University Teaching Hospital, under the leadership of our Chancellor, the Esama of Benin, we will be having a physical meeting with CoDA and some other stakeholders next month to be able to pilot the plans for us to begin to chart the way forward towards establishing a center in Nigeria to be able to control the space with respect to production of vaccine. And I want to assure you that very soon, with this initiative from the Chancellor and all the stakeholders, while we start to chart the way forward with respect to vaccine production in Africa, that Igbinedion University Hospital is strongly ready with the encouragement from the Chancellor and CoDA, working with CoDA and other stakeholders, that we will be able to make available what it takes to kickstart the production of vaccine in Africa. So once more, I want to thank you all for your contribution, and I want us to do more than just the talking. Let us put our hands together and ensure that Africa, once again, is not a dumping ground, but a place where we can actually begin to, champion the affairs of Africans the way it's supposed to go. Thank you very much.
Thank you very much, Professor, for those words of wisdom. Yes, Africans can produce vaccines for themselves. Yes, Africans can be the owners of the value chain around vaccines, but to do that, we must work together as Africans, not just Nigerians on their own, Malawians on their own, but the entire African continent. 1.3 billion Africans, collective GDP, $2.5 trillion. When we work together and produce vaccines, there will be a market from Africa. Only if we think of ourselves as Africans, not Nigerians, not Malawians, not South Africans, Africans. So thank you, Professor, for emphasizing the issue of African agency. We must consume vaccines that we produce ourselves. We must consume vaccines that we test ourselves. We must be in charge of our public health. The next stage now, we're moving to the issue of the response. What is the Africa CDC response? What is it? The stakeholders, the young people, the experts must know what that response is, then be able to respond to it, provide ideas, provide critiques, be able to engage that response. So in this session, there will be a presentation of the Africa CDC response. Then there will be a respondent who's going to analyze it and evaluate it and give us feedback on that response. That is the motivation behind this session, to make sure that we understand the CDC Africa response and also have the stakeholders present their views about it. Now, to present the response as structured by CDC Africa is Dr. Benjamin. Dr. Benjamin is a medical doctor who is head of policy, health diplomacy, and communication at the Africa CDC. He has been appointed in May 2020 as the executive secretary of the AU COVID Response Fund. He was head of mission of the AU support to Ebola outbreak in the DRC from 2017 to 2018. He was also head of mission support for African Union for Ebola in West Africa. He also holds a master's degree in population studies and public health. Dr. Benjamin, tell us, what is the CDC Africa response? What are the key components of it? So that as stakeholders, as Africans, we can give you our views. Dr. Benjamin, the moment is yours. We are giving you about 10 minutes to present the CDC, Africa CDC COVID-19 response. Dr. Benjamin, the moment is yours.
Thank you very much, Prof. Eddie, can I have my slides on, please? Thank you. Okay, thank you very much. My presentation is not very much different from what you heard yesterday from Dr. Ahmed. Next slide. We will start with the epidemiological update, then we will move to the Africa CDC coordinated response and the takeaway message. Next slide, please. So as of yesterday, we have more than 4.4 million cases and more than 3.9 recoveries and more than 117,000 deaths, resulting on 2.7 case fertility ratio. This is the 7-day moving average on the right hands here. You can see clearly that we had, yes, we had two peaks of the pandemic on the continent. The first one was around July, when we registered about 18,000 cases every day. And the second peak, the peak was around end of December, where we recorded more than 32 cases per day. So today, it's like, please click again, one click. This is where we are. It looks like the situation is consolidating itself in this round circle. We will wait to see in the coming weeks if the trends will be upward or downwards. Next. In terms of the reporting from the countries, we can see that one country is not reporting. We are not receiving data, and that is Tanzania. And we have the colors of the countries that are reporting between 1 and 10,000 cases, and between 10,000 and 100,000. And we have 2 countries that are reporting more than 500,000 cases. These are South Africa and Morocco. Next. This is Africa CDC strategy. We have 3 pillars. The first pillar is on preventing transmission. The second is on preventing deaths, and the third one is on preventing the social harms. Next. This is how the strategy at the continental level is organized. Click again. Click again. One more. Okay, good. So we have the Bureau of the Head of States and Government who is overseeing the entire response. Under that one, we have the continental AFCORT. AFCORT is the Africa Task Force for Coronavirus, which meets every day, every Tuesday's afternoon. The steering committee, and the steering committee convene and coordinate the implementation of the strategies for the countries. And then we have on the left hand side here, we have the technical working groups. We have 7 technical working groups, one on surveillance, another one on clinical management, another one on infection prevention and control, up to science standards and the regulations. And we have also, we have also the Ministerial Coordination Committees that has been established by Head of State and Government. We have 3 Ministerial Coordination Committees, one on finance, the second one is on transport and logistics, and the third one is on health. And what they do is to implement the finance coordinating committee, ensure that the resources are mobilized, the transport and logistics to ensure that all the supplies are deployed to the countries, and on health coordination, we have the implementation of this response. And below that one, we have the same setup at the regional regional level. So in each regional economic committee, we have the similar setup for the overall coordination response. So this is how the continental organized itself to respond to the COVID-19. Next slide, please. Yes, slide. Okay, this is the timeline of the response. The response started on the 14th of February when the chairperson I mean, Egypt recorded his first case. And then on the 22nd February, the chairperson of the African Union Commission convened the meeting of the ministers of health of the continent. It was an emergency meeting, and that meeting established the Africa Task Force on Coronavirus and also endorsed the continental strategy. You can see the timeline. I'm not going to take you through all, but you can have the slide later on. You can look at them. And up to the 13th April this month, where the partnership for Africa vaccine manufacturing was launched to scale up vaccine manufacturing in Africa. Next. This was the ministerial meeting in Addis Ababa, where we have more than 37 ministers attended, with the objective to coordinate efforts to combat COVID-19 and to promote evidence-based public health practice for surveillance, prevention, diagnosis, treatment, and control of COVID-19. Next slide, please. Just continue. Next slide. Yes. So, once back. So this is just the details of what transpired during the 1 year that we are into this pandemic. We have produced more than 30 guidelines on surveillance, laboratory, infection prevention, control, case management, and many more. And they are all available on Africa CDC website and African Union websites. Next. The partnership for to accelerate COVID-19 testing also was launched, and our target was to reach 20 million tests by end of October 2020, but we reached something like 30 million by October 2030. And the goal was to deploy 1 million community health workers to train 100,000 healthcare workers and to establish a continent-wide platform for laboratory and medical supplies. Next. So this is the African Medical Supplies Platform, which is a single online marketplace to enable the supply of COVID-related critical medical equipment in Africa. We have the website there. Everybody can go and visit there. And it was developed under the leadership of Mr. Strive Masiwa, who is one of the AU special envoys, and in partnership with the Afrexim Bank, UNECA, and many more other partners are joining this initiative. Next. Yes, in terms of diagnostic, the rapid scale-up of the diagnostic capacity for the continent was done, and we conducted many trainings. When COVID started, there were only 2 countries on the continent who can diagnose COVID-19, and these are South Africa and Senegal. Quickly, we formed 2 pools of trainings around these 2 countries, and today we have all the countries across the continent who are now have the capacity to do the COVID-19 diagnostics. Next. These are just the different initiatives that I have mentioned, the joint continental strategy with the goals. We have also the task force with its objectives to discuss and achieve the consensus on complex technical and policy issues. We have also the packs that I described earlier. We have the African Medical Supply Platform, the consortium also for COVID-19 clinical vaccine trial, with the objective of facilitate the start and successful completion of clinical trials, at least 6 promising COVID vaccine candidates for Africa, and also the Africa against COVID-19 saving lives, saving economies and livelihood, which is promoting harmonized, standardized, and coordinated entry and exit requirement for African Union member states through digital solutions. Next. So what are the key messages that we need to take away from here? One is the effective coordination works and at the very highest level on the continent. It goes from the head of state and government down to the communities. The second message is a specialized agency for the health security, Africa CDC. It is a very good investment for Africa, and it is our duty and responsibility today to sustain it and to support it, to deliver on its mandate for the health security of this continent. And also we have established trusted partnership for the great benefits of the populations, this continent. And the fourth takeaway message is the investment in a resilient health system is beneficial and very urgent. Next. Thank you. And this is just to show you the successful partnership that we have established with Mobile State. You see at the background there a C-130 sent by Cameroonian Air Force to deploy our responders to West Africa. Thank you.
Thank you very much, Dr. Benjamin, for that detailed outline of the response. There you have it. He was very clear on the content of the strategy. What is the content? Prevention of transmission, prevention of deaths, prevention of social harm. Then he also gave us the structure of the strategy, the organizational structure of the strategy, and then also the activities themselves, the timeline, and the key messages. That is the Africa CDC strategy. And one word I want to emphasize is prevention. As we do all this work, we must make sure that as Africans, we shift our health policies from curative, from disease management to prevention, to wellness. We must make sure Africans are well. We must make sure we prevent disease. And by the way, Big Pharma is not interested in that. Big Pharma or big pharmaceutical companies would want you to buy drugs. So they want to do disease management. We don't want that as Africans. We want prevention. We want wellness. Thank you very much, Dr. Benjamin, for that. But by the way, doctor, just because you call it Africa CDC doesn't make it African. How African is your strategy? Who is driving your strategy? Let us go to the stakeholders and see what they have to say. It is important that the Africa CDC strategy is driven by Africans. The Africa CDC strategy speaks to the aspiration of Africans. And hence, we're going to go and listen now to the stakeholders. Tracy is going to speak to us. Tracy Tumba is a governance specialist, provincial focal point for USID, UKID, and DFID. She has got interest in dispute prevention and resolution. She's a human rights lawyer and also interested in criminal justice. She has been working for years as an independent consultant in developing projects related to public policy, gender, elections, political participation of young people and women. She leads institutional reforms and supports decision makers by offering them local technical assistance to improve governance. Tracy has worked as a governance specialist and project coordinator throughout the DRC and quite a number of African positions. We want to hear from you, Tracy. What are your views on the Africa CDC strategy? Does the Africa CDC strategy address the African agenda? Is it driven by Africans? Tell us, as a key stakeholder, your views on the Africa CDC strategy with respect to COVID-19. Tracy, the moment and occasion is yours. Tracy, are you here? Tracy Tuba, is she here? Saudi?
She's here, Professor.
Okay.
She's on the list. Tracy, can you hear us?
Tracy, we're waiting for you to respond. Are you? Can you hear us, Tracy? Yeah, we can see you here, Tracy. You are muted, but are you around? Okay.
Yeah. She's. No, okay.
Okay, we can see her on this. She's logged in.
Yeah. Professor, she may have the same problem I had a few minutes ago. I couldn't hear anything. I had to leave the meeting and get back.
Okay.
Tracy Ntumba, are you in the room?
She says her microphone is not working.
Oh.
She has to leave the meeting and get back. It's one of those hiccups that happen on Zoom.
Yeah, Tracy, if you can hear us, please log out and log back in.
Okay, while we're waiting for Tracy,
Tracy, si vous nous entendez, il faut sortir de la réunion et revenir. C'est plus normalement ça redémarre ce qui s'est coincé.
Tracy says her mic is not activated. Can they please activate her mic for her? J'ai attendu tout le monde, d'accord. Mon micro n'est pas activé.
Yes, Tracy. Can you hear us now, Tracy?
Est-ce que vous m'entendez cette fois-ci? Vous m'entendez? Ah d'accord, c'est parfait.
We can see you, but we can't hear you. We can see you.
Je ne sais pas si vous parlez ou je peux y aller.
I can hear her, Professor. Professor, can you hear Tracy? Can you hear me? It's time for the professor also to sign out and come back. Allez-y, Madame Tracy, il va se joindre à nous.
Ben oui, j'ai l'impression.
Tracy, can you hear us?
D'accord. Merci beaucoup, professeur Mutombara. Merci beaucoup.
Thank you.
Les organisateurs. En fait, c'est pour moi un grand plaisir de prendre part à ces discussions. Premièrement, en tant que jeune femme africaine et deuxièmement ici en tant que spécialiste de questions de gouvernance. Et du coup, je pense que comme l'a dit tout à l'heure Philémon, le président de l'association d'étudiants en médecine, que c'est très intéressant de faire participer les jeunes à ces discussions parce qu'on l'a dit, l'avenir de ce continent nous sommes et prendre en compte les compétences et les des jeunes Africains. Alors, pour répondre à la question qui m'a été posée concernant les politiques existantes, je pense que le CDC effectue exactement un travail remarquable qui mérite d'être encouragé, mais en dépit de tout ça, comme l'a bien martelé le professeur en parlant de stratégie, il est important que le pilotage de ces politiques puissent être portés par les Africains que nous sommes. Ça veut dire que les problèmes africains ne peuvent trouver que des réponses africaines parce que nous vivons sur le continent et nous avons des réalités qui sont propres à nous. Il est vrai effectivement que la COVID-19 est une pandémie mondiale et que effectivement on est parfois voilà, on est appelé à travailler ensemble avec les peuples d'autres continents, mais il est important aussi de marteler sur le fait que les solutions doivent être africaines, d'où l'importance de pouvoir impliquer toutes les forces vives. En parlant de forces vives ici, j'aimerais beaucoup insister sur les compétences qu'on a à notre niveau. On parle beaucoup de lobbying pharmaceutique parce qu'aujourd'hui, on parle de vaccination, mais est-ce qu'on investit assez dans nos pays pour qu'on arrive à produire et à avoir nos propres vaccins? On est à un stade où le problème de nationalisme vaccinal nous dérange et nous met mal à l'aise, ce qui est tout à fait normal parce qu'en fait, ça a des conséquences néfastes sur la pandémie. Ça ne permet pas de réduire la pandémie parce qu'aucun État d'ailleurs ne vit on va se clos. Mais il est important aujourd'hui de réfléchir à l'après, à l'ère post-Covid au fait, parce que les pandémies, elles peuvent arriver. Les urgences sanitaires, on ne se fait pas le mal, mais nous vivons dans une société où il faut prévenir. La prévention, c'est être capable de doter du continent des moyens nécessaires pour qu'elle arrive à produire et qu'elle arrive à préparer l'avenir. Je pense qu'on va arriver à être totalement indépendant si et seulement si notre capacité de prévention, elle vaut mieux que tout. Je pense qu'il n'y a pas une meilleure solution à ces urgences si ce n'est que la prévention. La prévention, elle nous permet effectivement d'éviter le pire, elle nous permet effectivement d'éviter les contaminations, des pics de contamination, mais également d'éviter le décès. On a présenté, conformément aux statistiques, que ce soit aux côtés du CDC ou même des autres organisations internationales, que l'Afrique est le continent qui a été le moins touché par la pandémie. Mais je pense qu'il ne faudrait pas nous apaisantir sur nos lauriers en disant, ben voilà, parce qu'on a été le continent le moins touché par la pandémie et que voilà, on n'organise pas de plan de plan pour le futur, parce qu'il peut y arriver d'avoir d'autres urgences encore plus graves que ce que nous avons aujourd'hui. Et il est très important aujourd'hui que les États africains arrivent à s'asseoir et à réfléchir sérieusement à doter au laboratoire africain des moyens nécessaires pour qu'elle arrive à fabriquer ses propres médicaments. Et ça, c'est dans tous les domaines de vie, hein, c'est dans tous les domaines de vie, parce que les urgences ou les maladies, il n'y a pas que le Covid. Un autre élément important sur lequel j'aime sur ce point de vue, je pense qu'il est important de ne laisser personne de côté. En parlant de ne laisser personne de côté, j'insiste sur la place que les jeunes aujourd'hui occupent en Afrique. Parfois, on nous dit, mais est-ce que la jeunesse africaine a son mot à dire par rapport à la pandémie actuelle, par exemple? Et moi, à cette question, j'ai toujours dit oui, parce qu'en dépit du fait que l'urgence soit sanitaire, mais elle est devenue beaucoup plus complexe, avec des conséquences dans divers domaines, notamment sur des questions d'éducation et des questions d'ordre social. Hein. Déjà, on a aujourd'hui la plupart des jeunes qui n'ont plus eu effectivement, on a été appelé à fermer les écoles et du coup, ça a eu une incidence sur les générations futures, parce qu'aujourd'hui, si on n'est pas éduqué, si les gens ne sont pas instruits, on ne sera pas en mesure de former des personnes capables de faire cette prévention-là, des personnes qui seront capables de réfléchir pour arriver à doter l'Afrique des moyens nécessaires pour lutter effectivement contre les urgences à venir. Ici, le maître mot ou l'élément le plus important sur lequel moi personnellement, en tant que jeune femme africaine évoluant dans la gouvernance, aimerais marteler, c'est la capacité des États africains à saisir compte de ce qui se passe aujourd'hui et à mettre en pratique publique, que ce soit au niveau national ou même au niveau continental, pour arriver à préparer l'avenir. Parce qu'il faudrait éviter de se retrouver dans la même situation comme ça n'est le cas aujourd'hui. Aujourd'hui, les économies africaines ont été touchées. Ça veut dire qu'on est face à une pandémie, à une urgence sanitaire qui a fragilisé les économies. Ça veut dire important que chaque État à son niveau et le management au niveau continental puisse se rendre compte qu'il y a urgence aujourd'hui d'investir auprès des lobbying pharmaceutiques africains, il y a urgence d'investir auprès de laboratoires africains, mais aussi investir auprès de chercheurs africains. Les jeunes qui sortent des universités en médecine, que ce soit dans d'autres domaines, sont dotés d'une capacité d'innovation incroyable, et je pense qu'il est très important pour nous de leur donner la chance de nous faire découvrir ce qu'ils sont capables d'apporter. On a vu par exemple des cas dans des villages très éloignés, moi je suis en RDC, où par exemple les populations ne pouvaient peut-être pas être en mesure d'avoir les gels désinfectants pour nettoyer les mains et tout le reste. Les jeunes ont pu, à travers plusieurs campagnes, mais aussi à travers des actions sur terrain, trouver des alternatives permettant un comportement capable de freiner la propagation du virus. Donc, voilà un peu de façon générale ma
Tracy,
contribution, ma réponse à
Tracy,
cet aspect des stratégies.
You can wind up. Okay, thank you very much, Tracy, for that intervention. We are very grateful for your response. You are very clear. You are very clear that Africans must drive the African response. You're very clear that Africans are in charge, should be in charge, because Africans are the ones who live on the continent. You also spoke very eloquently against vaccine nationalism. You also emphasized that we must prepare for future pandemics. We must do research and development on the continent. We must do manufacturing of drugs on the continent, not only for COVID-19, but for all diseases. So thank you very much for those insights. You also emphasized that we must leave no one behind. So CDC Africa, please do not leave any African behind. Please, CDC Africa, do not leave any African idea behind. Make sure you engage with the entirety of the African continent in terms of ideas, in terms of solutions, so that your strategy becomes a purely African strategy which leaves nobody behind. Thank you very much for Tracy for that. And also thank you very much, Dr. Benjamin. We are now going to move on to our last session. In the last session, we are saying, what are we doing around vaccination? What is the post-pandemic era for African youths? So Dr. Ndebi from Africa CDC will take us through the ideas of vaccination and post-African pandemic in Africa. And then we have responses from young people from the continent. It is important that we are clear on the continental vaccination program. And also in that program, we create space for young people. Young people must be at the center of our discussion. Young people must be part of the vaccination program on the continent. But more importantly, post-pandemic, we must have an agenda for African young people. How do we see young people post-COVID? How do we see young people post the pandemic? Okay. Dr. Ndebi is a senior science advisor at the Africa CDC. In his role as senior advisor to the Africa CDC, he's also editor-in-chief of the Journal of Public Health in Africa. He's a virologist and a public health expert, and also an adjunct associate professor at the Division of Epidemiology at the University of Maryland in the USA. He's a research professor at the Global Affairs section at Kanazawa University in Japan. So academically, we're in good hands. Dr. Ndebi has served on several scientific advisory panels and continues to serve as an advisor on HIV drug resistance and control policy to Nigeria's Federal Ministry of Health. He's a member of Farm Access Technical Advisory Board and the Pan-African Study for Evaluation of Resistance in Africa. So he's here representing Africa CDC in terms of science. He's going to take us through the vaccination program and also speak on the idea of the post-pandemic era for African youth. Whatever we do, we must make sure we keep the young people on board. Whatever we do, we must make sure the young people are the drivers of the agenda. In any case, the young people are leaders of today. Dr. Ndebi, can you take us through the vaccination and post-pandemic era for African youths? The moment is yours, Dr. Ndebi.
No, thanks so much, Prof. Mutambara. Thanks so much for excellencies, the commissioners on this call, and the dignitaries. Really, it's a great honor and really pleasure to be on this. And also thanks to my colleagues, Dr. Benjamin, for inviting us as part of the Africa CDC family. Yeah, I think I wanted to start this presentation really by on some of the key achievements that Africa CDC, beyond what Dr. Benjamin just presented shortly, around finding really Africa solutions to Africa problems. Right now, it's a focus more on the vaccine manufacturing. And, you know, we've convened a continental consultation, a virtual conference, a summit at the Africa Union, Africa CDC, which was well attended. Over 40,000 participants across the globe from 100 countries have at least attended. I think it just gives you the perspective that really beyond the continent, there's really a huge interest in building capacity and also strengthening resources around vaccine manufacturing. So basically, if
Dr. Debbie, are you okay?
Yeah, I was saying we launched the partnership for African vaccine manufacturing as well as the framework for action with milestones. So that's I think one of the outcomes for that summit. And the vision really is to ensure that Africa has timely access to vaccines, and then that will protect actually public health security by establishing sustainable vaccine development and manufacturing ecosystem in Africa. I think this is beyond just the COVID-19 vaccines, and also that will actually cover other really routine immunization program on the continent. Very important as we ensure that our youth are covered, are being immunized, and also as they form actually the backbone of our activities in the continent. So it's quite clear that alone we can do so little, but together we can do so much. So that's why we're launching those partnerships to ensure that our security in the next 15, health security in the next 20, 15 years, it's actually been taken care of. So that was launched, the partnership. But let me just really have a deep dive of where we are in terms of vaccination. Very important, vaccines and then now vaccination. Those are two different concepts. And the aim here is to really to be able to save life in the long term. That's very important. So now, but when you look at this map globally, it gives you a kind of a snapshot of what's going on. There's still a slow rollout of COVID-19 vaccines on the continent. Obviously, this is going to change in the next couple of months with different initiatives that Dr. Benjamin did mention, as well as what I'm going to touch base on as part of securing COVID-19 vaccine supplies for the continent. So where are we globally? So as the Americans will plan, which is very good, to at least vaccinate about 80% of their population. China aims at vaccinating 70 to 80%. Italy aims to vaccinate at least 80%. We as African, we as part of the continent, we ambition at least to vaccinate at least 60% of the population. But these numbers are actually guided by science, because to reach herd immunity for measles, for example, you need to vaccinate about 80 to 90% of the, let's say that's at least what we all know. If you want to really protect our youth, ensure that we have really a young, vibrant population, really have to be sure that they are all immunized. So then that's what I've said. Having the vaccines is one thing, and then having really smooth implementation or rollout of vaccination program will go a long way in achieving our goals as a continent. So I'm just going to skip this, but give you an idea that if you want to have which vaccine have been deployed where or administered, we have developed a dashboard. It's on the Africa CDC website. You can go there. If you're from Cameroon or Chad, you can go there and click, and you can know exactly how many vaccines have been deployed there and how many have been administered. as part of your, information on the continent. So where are we? I think basically you've all heard about the COVAX initiative. And then the COVAX actually is an initiative by CEPI, WHO, and the World Health Organization. And the aim there is to vaccinate about 20% of the population. Okay, so they will have access at least to 20% of the COVID-19 vaccine that will enable us at least to cover 20% of our population. I think as Africa Union and Africa CDC, we aimed a little bit higher than that, as I mentioned earlier, 60%. So far, at least the plan was by the end of May to have about over 70 million doses of the vaccines being actually deployed or inoculated or delivered to the continent, including the AstraZeneca vaccines and the Pfizer-BioNTech vaccines. So where do we get the extra 40% for those who are following? 20%, our target is 60%, means that we have to outsource extra 40%. This is a laudable initiative that the continent has made, not just waiting for those vaccines to be provided, but they went further, allowing the leadership of the continent and then to really outsource additional 40% through different mechanisms. Then the African Union initiative called AVAT, the African Vaccine Acquisition Tax Team, has been able to secure about 400 million doses to achieve the 60% target. So it means the access and then the financing, because those are linked. Then it means through Afreximbank and the Africa Vaccine Trust Initiative, which is a mechanism or a legal entity for the African Vaccine Acquisition Tax Team. Let me now take you through. You'll definitely see or recognize your country there. And about 26 countries have secured at least vaccine doses that will enable them to cover at least 30%. The coverage means beyond even the 20% offered by the COVAX facility. But we still have some countries that have not been able to secure any of those deals, either the COVAX facility or the AU through the African Medical Supply Platform that was presented earlier by Dr. Benjamin, and through bilateral deals. And which is worrisome. As we said, we aim to the whole of Africa approach. We don't leave anyone behind. That's why in this initiative, all member states were allocated vaccines, at least they had to claim after a certain time. So that was the first phase, and there will be a second phase by which we encourage all member states to claim their own allocation so that they can be able to secure the life and also inoculate, protect their own population. So about 17 countries have secured about 30 to 60%, despite the scarcity or despite the scramble in getting those supplies through different mechanisms. You can see the colors. There are 3 colors that, and you see that countries like South Africa have gotten through bilateral deals, through the AVAT, African Medical Supply Platform, and through the COVAX facility. For me, it's very encouraging because that's towards this challenging time, member states are going extra miles to secure enough vaccine for their own population. Then the good news, we have countries that have secured about more than 60% of what will be required. As I remember, we say at least 60%. You can go beyond that. The more you cover, the more you can reach herd immunity with the challenges of the vaccine, the variants and the new variants that actually diminish or reduce or the efficacy of the vaccine. So going beyond that 60% is even commendable. So this is a map giving you at least where the vaccines are being distributed, different vaccine types across the continent. I'm not going to dwell much on that. But the focus here is around healthcare workers having a resilient health system by vaccinating at least all those frontliners, and then people with comorbidities. But remember, again, the African population is really made up of youth, some below 18. I think that's also something we need to look at as we're prioritizing so that they don't remain the reservoirs of the transmission of the virus. I will leave you with 3 key challenges as part of this initiative. One, the access to COVID-19 vaccines, the global scramble I did mention. You have heard India, you have heard other countries first protecting their own populations. But now we as Africa, we have said, let's start manufacturing at least vaccines in the short or medium term, so that we can have at least 5 hubs for vaccine manufacturing on the continent. Then second, the significant logistics challenge, because we aim to vaccinate about 35%. This is an unprecedented time where at least the global population have to be vaccinated or inoculated, but we aim at least 35% to vaccinate at least 35% of the population by the end of this year, and then the remaining 25% by 2022. And then I mentioned already the challenge of having the new variant and the mutation that may actually had an impact on the effectiveness of some of these vaccines. So I thank you, and then I will leave you with this beautiful map showing where these variants, this new strength of the virus, as the virus was spread, and if not properly contained, the virus can actually, some of the mutation can be selected by some of these viruses, and this might actually jeopardize our vaccine campaign. So my chair, Professor Mutambara, thanks so much for listening, and I'm happy to take the questions. Over.
Thank you so very much, Dr. Ndebi, for that clarity in terms of the vaccination journey. Thank you very much for addressing what we want. Africans are sick and tired of being consumers of other people's vaccines. We want to be producers of vaccines. We must consume our own vaccines. So thank you very much, Africa CDC, for starting the journey towards research and development, the journey towards the manufacturing of vaccines on the continent. Thank you, Dr. Debbie, for emphasizing the issue of unity, integration, and partnerships. Scale is what will allow us to manufacture vaccines on the continent. You can't do it for Malawi, do it for Gambia, do it for South Africa. You can do a manufacturing hub for a region, for ECOWAS, for East Africa, for SADC, a manufacturing hub for the continent. Economies of scale are very important if we're going to succeed in terms of becoming producers of vaccines on the continent. Thank you very much for the message around vaccine and vaccination, the difference, and emphasizing that vaccine plus vaccination will produce the saving of lives. So what we want in Africa is, number one, vaccines. Then once we get the vaccines, we want vaccination. Once we get those two going, we can save lives on the continent. Thank you so very much for those details. And again, emphasis, leave no African behind. But more importantly, you as Africa CDC, leave no African idea behind. Make sure you take on board, you take cognizance of all African ideas as you craft the African response to COVID-19, as you create a new public health order on the continent. It must be driven by Africans in African wisdom, African insights, African ideas must be the center of Africa CDC. Now, to respond to those great ideas, our young people on the continent, the Africans must have a say. The young people must have a say. The young people must have a say in terms of what is going on, in terms of the strategy. To take us in terms of response, we start with Stan Moto, who is an author, publisher, and producer. Stan is a writer of children's books, of poetry, and he has worked extensively with works like Tears in My Hands, Under the Shade of Wisdom, Emotionally Disarmed, and Yet We Pray. These are the young people we want to have a say in terms of our strategy. These are the young people we want to have a say on vaccination on the continent. Stan has participated in a number in a spectrum of international meetings, events, and conferences, including the 10 African Union Summits, the African Diaspora Summit, COP17, and the BRICS Summit. These are the young people who have been active on the continent. So we want to get a response or some ideas from Stan as an author, as a publisher, as an entrepreneur. Stan, the moment is yours. The occasion is yours. We give you 5 minutes only. Stan, the moment is yours.
Thank you very much, Professor, and thank you very much. Yes, thank you very much, Professor, and thank you very much to the Africa CDC, the CoDA, and the African Union for organizing this August event to help us have a voice, especially for the young people in Africa. I'm actually going to touch on the voices of the youth that are needed in order for us to be able to move forward. I think I will just specifically talk about, do the youth have any voice in the vaccine and vaccination process? And maybe just also to acknowledge the presentation of Dr. Ndembi. I think it talked about the importance of having timely access to the vaccine. I think this will also be touching on that. African youth misrepresented in the process of the vaccine and the vaccination process. What can the African authorities do? And this is now the government and the organizations that are leading the process. What can they do to ensure that they strengthen young people's participation in the process itself? What can the young people do themselves? Because it's not only enough for governments to do something for the young people, but then I think the question has to do, what can you do, young people? What are you capable of? What are you prepared to do for your own continent? Because this is your continent. What changes can you make? What improvements do you want to see after COVID-19 has come to pass? And I think I'll make also a few recommendations at the end. I think the professor has already touched on my profile, so I think I'll jump on that. I think, but the question that I want to deal with now is, do young people have voices in the COVID, in the response, in the vaccine and the vaccination process? Yes, they do have a voice, but I think this is minimal. And I think the reason why they have a minimal voice is because at times, and especially at the beginning, when the vaccine, hit our shores, the communication there or the approach was, we had to listen to the leaders of government on what to do because nobody knew what to do. And I think that was understandable. But as the time went on, I believe a platform needed to be created for youth to be involved, to engage, and also to lead in terms of bringing in the suggestion to say, this is how we see the process going forward in saving ourselves and saving our own life. So I think that has been improved with time, but there could be more that can be done. There are response committees in many countries. There are task teams. I think Dr. Ndembi talked about the task forces, the task teams. And then the question has to be, how much are young people involved in those task teams? Is it just for specific people that are called expert? Is the experts only people that are older? What if we integrate young people in the process of so that then they gain the knowledge in the meantime, so that later on they can then carry the baton and carry the successes and the prospect of Africa forward. And I think that's what we're looking forward. Yes, in the beginning, young people, especially for various disabilities, were totally left out. And I think this is also something that we need to emphasize, that we've got youth that have got limitation in terms of disabilities. And our presentation and our strategies that we're talking about have to highlight that, and deliberately so, because this is part and parcel of our communities and society, and they cannot be left out. We just talked about that. Dr. Ndembi just said now that alone we can do very little. And people with disabilities included can do more for us as well. At the beginning, youth have lost a lot of jobs, and I think they were disillusioned, and they were afraid, and they did not know what their future was going to look like. And at some point, they were just on a survival mode rather than looking forward to say, what can we do? So I think some of them became passengers in this process of the response of the vaccine and the vaccination. And I think we also talked about some of the confusing messaging that is coming, along. I think, and I think we need to emphasize on government, maybe at the highest level, to say we need consistency in messaging so that the young people who were passengers because start to become part of this moving bus or train and start to emphasize or become even the ambassadors of vaccination, because we need everybody to be vaccinated in order for all of us to be safe. I think this is just African youth misrepresented. I do not think so. Young people were not misrepresented because the COVID time is still a trying and uncertain time for everyone. So we are still trying to find ways in which we can deal with it. But I think more than anything, we need responses and assurances, especially from those who lead, so that we can all be a continent that is saved. The knowledge base, the pool of wisdom that is there, should be able to then remain. What can African authorities do? African authorities need to trust more in the youth. There are skills that our youth possess in different and various spectrum of sectors and industries. And I think we need to bring them on board. And they can be used to augment the wisdom of the elderly people that are there. And I think one of the things that I've mentioned here was that we also need to say our organization and the multilateral organizations that we have, how much of a percentage is there for young people? The African, the Pan-African Parliament, the parliaments that we have in different countries. And I think this is the space that we can use for young people to get involved, because that is where the policies are discussed, that is where the policies are adopted. So they should be involved in that process where the policies are developed and discussed, and this will then feed in any other social issues that we're dealing with. The professor yesterday mentioned that the COVID-19 vaccine process has a dependencies, and part of the dependencies are social, part of the dependencies are economic and political as well. And I think we have to take this concoction on board when we try to deal with this issue, and also involving the youth. So their participation must be deliberately increased by involving them in that process. Let's hear them, and this is what we say. Let's engage them, and let's implement their proposition more, and then let's send them away. Already we're talking about some of the countries that have vaccination program. We do not have a vaccination program. Let's send them to India if we can, so that they can benchmark and bring that, because we do not have a vaccine development closing date. And I think somehow we're talking as if the closing date has expired and we cannot do anything about. And I think this is the task.
Start winding up, Stan, start winding up.
Okay, thank you very much. And then I think, yes, I think this is where we can then start to effectively say to them, you can participate in this process. The closing date has not expired. We need to, as young people, to start to develop the vaccine for Africa, even today, even tomorrow, because there's still an opportunity for you to do that. They can become ambassadors and voices in the vaccination process by influencing their peers. So they should be, that's what I'm saying, the information that should be given to them must be very consistent, so that when they influence, when they talk to their peers, they can say, I am in a good space, and I think you're going to be in a good space as well. They can, yes, they can ensure that we incorporate the promotion of homegrown medicine. I think this is what we also left out to say. It's almost like when we talk about science, we talk about science as a foreign phenomena. And we've talked in the past of indigenous knowledge system. And I think this is one part that we've left out, and I think we need to bring it back, because there's so much potential in our indigenous plants. And I think as we give a task and challenge to the young people to say, go and develop the vaccine, we must also say, look into that corner as well. And this is just some of the things that the youth want just to, post-COVID, and I think we have to ensure. And I think it's also reliant on the dependencies that I've spoken about, getting their jobs and being able to be, participating in the economies of their countries and being able to also playing a huge role in the future leadership and inheritance of our continent, and ensuring that they resolve some of the challenges and become the anchors of the successes of the continent as well. This is some of the recommendation, and I think I'm winding off. And as some of it, I think they were just, maybe even, top of my head. I don't know if they will be realistic, but then I think every idea count. Young people need to leave a legacy in our continent. And usually when you say get involved in this, they say, what is in there for me? So my suggestion as part of the recommendations that when you say go out there and create, go out there and develop, go out there and establish, and name that vaccine after yourself, they will become excited and they will want to go out there. Go out there and create a car and name it after yourself, they will go out there and create that car without even saying where's the money. Yes, the resources are going to be required at some point, but then when you give them a challenge and say you are going to leave a legacy because that car is going to be named after you, they will definitely want to do it.
Okay, Stan, can you conclude now, Stan?
Yes, I just propose, I think this will be the last one, that let's have awards for our youth at the African Union Summit and realize and recognize some of the good things that they are doing. I think in some of the presentation we've mentioned the good job that some of the youth are doing. Let us elevate them, let us recognize them, especially at the AU Summit. I've proposed the Olusegun Obasanjo Youth Awards for Innovative and Excellence during I think I was just being excited because of the participation of His Excellency yesterday. And then I think maybe lastly, just to say, just like Joseph who went to Egypt as a food security ambassador, let us become the ambassadors of our own countries, let us become the ambassadors of our own continent, ensuring that what we do, what we talk, what we articulate is specifically for the benefit of our own continent. And I think there's some of the reasons I've mentioned already of the 50% of representative, especially in the parliamentary.
Thank you very much. Thank you very much. Thank you very much, Stan. CDC, you've heard the young people speak. Africa CDC, you now know what the young people would want. The AU leaders, you now know what the young people want. They want more involvement. They want more agency so that they actually are masters of their own destiny. The older people, thank you, Stan, for emphasizing that the old people, the leaders, must trust young people. Young people want to be players. We must create space for young people to participate. Thank you for that suggestion. But guess what? More importantly, young people must create the table, let's have more young people on the table. Let's create spaces. Yes, that is the agenda for the older people. But as young people, you must also define the table. You must also reorganize the table. Don't wait to be invited. You must get crushed. Young people are the leaders of today. We're going to move on to Esther. Esther is coming in. She's a social worker and a career catalyst with core competencies in career counseling, employability, entrepreneurship, policy, and strategy. Saddened by the high burden of graduate unemployment in Nigeria, Esther founded the After School Center for Career Development, an organization that trains and facilitates growth opportunities for young people, enabling them to transit seamlessly from school to work. Esther's influence spans the national and international spheres. In 2010, she became a Morem Initiative Fellow, selected among 25 young women leaders in Africa. Here is a distinguished entrepreneur, a young person who's making a difference already, a lead global fellow, and also a distinguished activist within the framework of young people. Tell us, Esther, what do you want? Tell us, Esther, what should Africa CDC do differently? Tell us, Esther, what can you do as a generation to create a new public health order on the continent. Tell us, Esther, what is the mission of your generation? The moment and occasion is yours, Esther.
Thank you so much, Professor Otto. Thank you for having me. Your Excellencies, dear colleagues, I'll permit me to please stand under existing protocols. I'm not sure I qualify, even though I'm a young person, even though I'm under the AU youth age, I'm not sure I qualify to speak on behalf of the over 60% of the population of the continent that are young persons, but I can safely speak from the perspective of my profession as a career coach, as a career counselor, and as a social worker who has worked extensively with young persons in the employment and employability field. I would like to, before I just go into the few points that I have, to recognize and to reemphasize, to say a very big thank you and well done to the Africa CDC and to CoDA for putting this together and for leading these conversations the last 2 days and bringing the whole continent together for us to have these conversations about the COVID pandemic and how it's impacted our lives. And I want to particularly also speak to the point about the fact that this pandemic is actually a global pandemic. It's not an African pandemic. And we do not, as much as we do need African solutions, Africa is not in a bubble. We don't exist in a silo. And it's a global problem, and the complexity of the virus, the complexity of the issues, that we are all dealing with the pandemic. It's so huge that we are all, trapped and we are all affected by it. And I'm speaking from my perspective based on the work that I do. I would like to emphasize also from a Nigerian perspective. Unfortunately, last year the coronavirus actually messed up. Further drove up our unemployment rates, such that we are dealing with a 40% graduate unemployment rate right now in our country, Nigeria. And we are also not just dealing with that at the graduate level, but we are also dealing with a lot of young persons who are currently not in employment, not in education or training. And of course, this is the experience of a lot of African countries, of other countries in Latin America and in the US. Again, these problems are actually being exacerbated, of course, by the COVID pandemic. And then, of course, also in terms of education, last year, suddenly a lot of young persons, for the first time in their lives, had to attend their classes online. So for young persons who come from families where they've never seen a smartphone in their lives, never touched a smartphone, never interacted with a computer, whether a desktop or a laptop or a tablet, suddenly have to now use it to learn online, not just to understand, not just they have to now learn how to use these devices and also have to, deal with studying online, and navigating the tools. And I want to speak to the point that we are absolutely challenged, of course, in our continent by, of course, the infrastructural challenges that we have, particularly in a country like Nigeria, where we are dealing with electricity cuts. And, we have countries like Kenya and Rwanda who, have very good data connections around their country. But in Nigeria, it's really not the same, and in other African countries. So there are bits and pockets of different experiences that children and young people have had to deal with, in the wake of this pandemic, whether in terms of their education, whether in terms of their training, and also whether in terms of their employability. So the spectrum of the challenge and the scale of the problem is quite different from continent to continent, from young person to young person. Depending on, for example, if you live in the urban or rural area, if you have access to electricity or access to tools, or if your family, is a small family, it's a different experience from a family of 4 to a family that has, for a family of 8, or with a family of, say, 6 children. So the experiences are quite different. And I would like to speak to the point about the question Professor asked about what would young people want. I think again, I always say I cannot speak for the generality of African young people, but again, the path that I can speak to is actually based on my profession and based on what I do, because I've heard the comments about being encouraged to become entrepreneurs and all that, and it's also something that I teach. It's something that we encourage, and we debate and grow entrepreneurs in our career center. But we also need to recognize the fact that there are very institutional problems, very institutional challenges to these young persons, going into entrepreneurship. And one of the things that we really need to recognize as Africans is the fact that we need to drive foreign direct investments. We need to have a lot of deal flows that come into the continent, especially right now that we are dealing with the pandemic. I mean, and we also need to recognize the fact that even though we do demand and ask for a lot of deal flows to come into the continent, we also don't have the money to make that happen as a continent. A lot of people who have money, unfortunately, Africans do not invest in Africa. They save up their monies abroad. They save up, they make their investments in safer clients, so it's really a problem. So beyond, one of the things that I also would like to speak to as part of the things that we would like to see going forward is really for the continent. I mean, unfortunately, we've had to hear, the very sad and terrible news today that came up from the Republic of Chad, God rest his soul, about the death of the president. I mean, the insecurity, in the continent, particularly in the Sahel region, it's a huge problem that we need to come together as a continent to solve. It's also our own epidemic. And as a continent and as a region, we cannot, I mean, we all know, even from our personal lives, you can't invest in a place that is volatile. You can't invest in a place that is volatile, or in a volatile community. You can't go and build a house or build a school or make certain investments. It's the same thing for for whether it's angel investors you're talking to, or impact investors, or just profit venture capitalists who want to come into your country. Security is a huge problem, and it's something that in the post-COVID world that we are approaching, it's a conversation we really need to have. And unfortunately, as citizens, we are not responsible for our security. It's the government. So it's something that the government really needs to.
Yeah, start winding up. Start finishing up.
Yes, I'm on my final point. So it's something that the government really needs to fix for us. And then I think the other thing that we need to that the whole COVID-19 pandemic has actually also taught us is really investing in our education and investing in information communications technology infrastructure for the educational system. We really need that, because we've already seen, I mean, in Africa alone, over 200 million young persons have been out of school, again, solely because of the pandemic. So this type of investment is really what we need to see happen. And we really need to invest in ICT education for a lot of young persons to be able to, not just to learn, not just to earn the right sets of skills, but for them to be able to do this entrepreneurship thing we are talking about. They really need to be able to get the right sets of skills and not just compete globally, but be able to access global opportunities. Because, I mean, if, for example, in Nigeria, if you're talking about a country of 200 million people, and there are very limited employment opportunities, but if young persons can have the right set of skills, they can actually get jobs online, they can deliver services, they can earn an income. There's a huge gig economy right now that a lot of young persons can take advantage of if they have the right set of skills. And then unfortunately, if our educational systems are not preparing them for that, whether as within the structured educational system or as extracurricular programs, we are setting up these young persons to fail.
Thank you so very much, Esther. Thank you for emphasizing employability. Employability is more important than long-term employment. Can we make sure our young people are employable? Can we make sure our young people are using technology to become employable, to become entrepreneurs? And also, can we sort out the institutional barriers that makes it difficult for young people to be entrepreneurs. Don't just tell young people, be entrepreneurial. Where is the infrastructure? Where is the energy? Where is connectivity? Make sure as African leaders, we create an environment where young people can be entrepreneurs. The barriers, the institutional barriers, infrastructure must be sorted out. Thank you very much, Esther, for talking about the elephant in the living room, insecurity. That's a pandemic in Africa. Insecurity. We must silence the guns. If we are serious on the continent, we must silence the guns. Thank you so very much, Esther, for talking about insecurity as a pandemic. So there you are, the session is done. We've heard the views from the CDC in terms of vaccination, in terms of vaccine manufacturing in Africa. We've heard a response from the young people, what they want, what they think must be done differently. So as CDC, as Africa CDC, let us make sure we take on board what the young people would want done. And also let us make sure that we take on board what the various stakeholders on the continent would want in the strategy. Just because you call it Africa CDC does not make your strategy African. What makes it African is creation of buy-in and ownership by Africans. It's creation of an ecosystem of involvement by Africans. As we conclude, I want to bring in one of the board members, Wandira Kazibwe, who is Uganda's first female vice president and first vice president in Africa. You have 2 minutes to share with us, Comrade Kazibwe. You are one of the board members of CoDA, and we want to hear from you, but we want to hear from you in only 2 minutes.
Thank you very much. All protocol observed. I want to also remind you, Arthur, that I'm a surgeon, but also a social scientist with a doctorate in global health and population from Harvard. Now, I want to congratulate everybody who took on the call of CoDA to participate in this two-day meeting. But specifically, I want to really raise some issues which I've heard being echoed. And I'll start with yours. We want well-being for Africans, well-being. And in the strategy is the CDC addressing an ecosystem that is going to engender well-being. So if the strategy doesn't, then the question of CDC owning an African strategy for the well-being of Africa will be out. And talking to the youth are saying they want to learn from us. Now, post-COVID, are we really going to teach you what works? Because I believe, being a medical professional, I need to be decolonized in the way I was trained, in the way the history of my ancestors vis-a-vis how they treated themselves is reintroduced to me, so that I can feel like an African and believe in African solutions. Because COVID has actually taught us that one of the reasons Africa has done so well is because we went back to what our ancestors were doing, using traditional remedies to boost our immunity, so that we actually did not get as far as our colleagues from the West and Europe. Now, when it comes to really communicating what needs to be done post-COVID, we are really short of being communicators in the public health sector. That is an area which we must master if we are to bring Africans on board with what CDC is planning to do. And when it comes to financing, Arthur, whoever pays the piper calls the tune. If we are going to run to Gavi, if we are going to run to Europe, if we are going to run to USAID for TB, for everything, then just forget our independence. If we are going to run there for them to pay money to train our scientists, we are going to lose out. I have been sitting on the Strategic COVID Committee for Uganda. But I'll also tell you, when you look at the national health accounts of my country, the public, including donors, do not sponsor what a Ugandan uses for their health. 60% of what a Ugandan uses for their health comes from their pockets. So we have to rethink how to reorganize our populations in Africa to know that they actually own the health sectors in their countries, not only through the ministries of health, but through the ministries of water, through the ministries of housing, so that the ecosystem you are talking about, Arthur, can be reintroduced in our own minds to know we can actually own our health. Finally, the young people. I was a minister of youth once, very, very active in Africa and in the Commonwealth. I would like to say that I'm very happy with what happened during COVID. It removed our children from these classrooms where they are cramming, and brought them into the environment, and they got to know there are things to learn outside the classroom. Can we hitch on to this so that we introduce them to something more viable for the future of Africa? So the youth, I want to call upon you, and Esther, thank you for bringing this out. Demand for an overhaul of whatever you are learning now. But I want to tell you that if we are not decolonized, we, the people who make the policies, then post-COVID, we are going to go back to what was there before, not being prepared for a post-COVID era where you will move Africa forward. I thank you very much, and congratulations, our Secretariat at CoDA, for bringing all these experts on board. Thank you, AU, thank you, ECA, and thank you, CDC. I would love that name to be changed to something different, because the Center for Disease, then we look at Africans to fall sick before you actually say, please, Africans, be well, so that Africa can be well. Thank you very much.
Thank you so very much, Dr. Kazibwe, for those words of wisdom. I hope Africa CDC was listening. I hope Africans were listening. I hope our scientists were listening. Let us put wellness at the center of the COVID-19 strategy, at the center of the Africa CDC. Let us make sure we put young people at the center of our work at Africa CDC. Let us make sure that Africa CDC is decolonized. Are we decolonized at Africa CDC? Tell us, Dr. Benjamin. We must make sure that we take on board indigenous knowledge systems as Africans with contributions to make to medicine, with ideas and solutions to our own medical matters. Why don't the CDC Africa be a champion of African remedies? Post-COVID, we must make sure we are ready to be Africans. Financing, thank you so very much, Doctor. He who pays the piper calls the tune. Who's funding you, Africa CDC? Why don't you get more Africans funding you so that you can be driven by the African agenda? Thank you so very much for emphasizing the ecosystem approach to make sure that we can succeed as Africans. I want to thank you very much, Dr. Kazibwe. As we conclude, I'm going to call upon Saudi, the Executive Director of CoDA, to give us some closing remarks. Thank you for being a great audience.
Prof, excuse me, I'm sorry to call you like
But you have two hands there. Prof, you have
Excellency,
Professor Sarah
Commissioner
and Professor Herrera from Cuba, who are requesting for the floor, Prof.
From Cuba, yes.
Oh, okay. Okay, no problem.
Yeah, Professor Sarah.
Okay, there's doctor from Cuba. We'll give you 2 minutes to speak to us. Dr. Luis.
Yes, it's a real pleasure to have the opportunity to discuss with you, and because for us it's you are very close in all respects. We are part of the African continent. Well, my idea is just, it has already been said, is that we should try to establish a kind of a strategy, and which are the main steps we should do in order to achieve this goal, this particular goal concerning how to overcome of the measure, in terms of the vaccine, in all what we consider important in practical terms, in order to help and to create the condition to overcome this difficulty. It's just that what I want to say.
Thank you so very much, Doctor, for those words. Professor Serra, His Excellency Professor Serra, can you say a few words in 2 minutes?
Yes, Professor Ato. I said at the beginning that I was representing the Commissioner for Economics and Trade and Industry, and he had his response to speak. So what I'm going to speak about in 2 minutes is an update on the key initiatives undertaken by the Department of Trade and Industry in relation to Africa's response to the COVID-19 challenges. Among them, it is worth mentioning the draft policy paper entitled Africa's Policy Response to COVID-19, Trade and Industry Perspective, where the AU Commission and the African Union Commission, Afreximbank, Afro-Champions, and UNECA have a joint communique on the need for a holistic and coordinated trade and investment response to the COVID-19. Secondly, they convened a virtual meeting of the AU Subcommittee of Directors General of Customs with a specific objective to smoothen border processes for SMEs. Thirdly, they were able, in coordination with the Department of Social Affairs, they engaged key financial partners such as the African Export-Import Bank, Afreximbank, the African Development Bank, the International Islamic Trade Finance Corporation, and the EU Investment Bank to open lines of grants or credit at 0% interest rate to facilitate access to health equipment and pharmaceuticals and prioritize investment in Africa's pharmaceutical sector. This responds to the African challenges, providing the means and the infrastructure and finances for the youth of Africa. In this regard, they were encouraged by pledges from the Afreximbank to set up a $3 billion facility to support African countries in responding to the COVID-19, and by the raising by the African Development Bank of an exceptional $3 billion in a 3-year bond to help alleviate the economic and social impact the COVID-19 pandemic will have on livelihoods and Africa's economy. So there are indications that ITFC has also pledged to put in place 2 facilities of $300 million and $550 million to support OIC countries, some of which are African countries. And they also work with organized African private sector organizations such as the Afro-Champions Initiative, the Pan-African Association of Chambers of Commerce and Industry, African Regional Business Council, to encourage their members and the African private sector in general to scale up their corporate social responsibility interventions in countries and communities where they do business. And also to encourage African Union members to promote monetary and fiscal stimulus measures aimed at stabilizing African economy. Finally, to work with relevant stakeholders to encourage and promote the development of apps, artificial intelligence, and robotics to facilitate the control and monitoring of the pandemic, as well as distribution of medical supplies and basic necessities. I have just tried to summarize what he was supposed to say, and all this also reflects the conversation we have had. And Prof, when you say that CDC, African CDC should do this, I want to tell you that implementation takes place at the level of the member states. And CDC has put everything in place to advise member states to do the right thing. And we are the African Union, we are the Secretariat. So we follow whatever you say. And right as you've been saying, I like your voice in which you are speaking like a youth, advocating for the youth like the youth themselves. Thank you very much, sir.
Thank you very much, Commissioner. Thank you, everyone, for a great 2 days. We have had an excellent opportunity to share, to discuss, and learn. So to conclude our sessions today and our conference in total, I hand you over to the capable hands of Saudi, she is the Executive Director of CoDA. Thank you, Saudi, for giving me this chance to be the moderator for today. I hand over to you.
Thank you very much, Professor, for such a dynamic and engaging management of all the sessions you had to attend to. I wish to express appreciation to Her Excellency Commissioner Young on behalf of the board of CoDA for having been with us throughout this afternoon. Thank you, Commissioner. I sincerely hope that this dialogue met your expectations. I would like to also convey a big thank to our moderators, presenters, respondents for the active participation. Thank you, Dr. Benjamin. Thank you, Nyambe, for having been with us throughout since yesterday, Africa CDC. We do hope that the support that CoDA expressed and this dialogue would have brought some of the messages that you are expecting a platform like CoDA to bring about. I sincerely hope that we will be able to engage more on these and continue these conversations. Thank you all, and we look forward to our next consultation. Goodbye, everyone.
Goodbye. Thank you, everyone.
Thank you. Bye-bye. Goodbye. Goodbye, Dr. Luis. Thank you very much.